In India, the outcome of cancer is very poor because of late detection. So, a patient, when he or she comes to you at stage 3 or stage 4, the survival chance is low.
Namaskar, welcome to Netaji Subhash Chandra Bose Cancer Hospital. We are on a discussion with Dr. Soumen Das, a surgical oncologist.
Namaskar, I am Dr. Soumen. I am heading the surgical oncology department of NCRI Hospital.
Why is early detection so crucial in the fight against cancer?
See, the problem we face day in, day out is the late detection. In India, the outcome of cancer is very poor because of late detection. Most of our patients, they attend the hospital, they come to the hospital in stage 3 or in stage 4. So, the problem here is the time, at the time where the patient is coming to us. If the patient comes to us in stage 1 or stage 2, then the treatment outcome is much better in comparison to stage 3 or stage 4. So a patient, when he or she comes to you at stage 3 or stage 4, the survival chance is low. In comparison to the fact that if the patient comes to you at in stage 1 or stage 2, the survival is pretty high. So our whole aim should be to detect the cancer at an early stage and to start the treatment at an early stage. That's why I always tell that early detection is the key in improving the cancer care in India.
What are some common types of cancer screenings available?
So the government-sponsored cancer screening are not that much well available in India, but in US or UK, we do have cancer screening for breast cancer, cervical cancer. Government of India, they have started a cancer screening program taking into the breast cancer, cervical cancer and oral cancer into account, where by doing the self-breast examination, clinical breast examination and mammography, pap smear for cervical cancer, we can detect cancer at an early stage. Now here one point I'd like to make, that what is screening? Screening is basically you detect a cancer when the patient is apparently asymptomatic. That means if today the cancer cells in my body that start developing, they will take at least 2 months, 3 months time to become symptomatic. So at the time when I am harboring the cancer cells in my body, I won't be able to understand whether I am having this or not because symptoms are yet to appear. So this is the time period or time window where we have the cancer in our body, but it is not symptomatic. So this is the window. If you do some tests in this period, if you can pick up the cancer, it will be very early, right? So in this case, if you detect the cancer, it will be very easy to treat and the chance of cure rate will be higher.
Can you share any success stories where early detection made a significant difference in our patients' outcome?
Right. So we do have a good number of patients because of increasing awareness. Patients are coming to us at an early stage, and we have a project of teaching the peripheral village doctors, because once a patient gets something, any problem in his body or her body, he or she goes to the nearby doctor, right? So we are giving education to those village or peripheral doctors so that they can pick up early disease. Now, with the advancement in this modality, we can now pick up cancers at an early stage. So we did get few patients who come to us at an early stage and they are being treated properly. I have personally treated a good number of patients who have come to us at an early stage. I personally treat breast cancer. Most of these breast cancer patients were treated without sacrificing the breast. So that is the beauty of early detection. If I can detect a breast cancer at an early stage, I can preserve the breast, I can do the operation without sacrificing the breast. Some of them might not require chemotherapy also. So they are treated by doing simple surgery only. So that's the beauty of early detection. If you can detect at an early stage, the treatment is smaller, patients might not require chemotherapy and other modalities of treatment. Only surgery with radiotherapy is good enough. So yes, we do have such success stories. We have treated a good number of patients at an early stage.